This is my next video on pregnancy series where I will tell you what changes come in your body in the 4th month of pregnancy, what is the growth pattern inside the child, what are the important tips for you, week by week. So in this video I will explain you about week 13, 14, 15 and 16 in detail. Do watch this video till the end. So let's talk about pregnancy week number 13. What changes can we see inside your child in the 13th week? So in pregnancy week 13, your child's eyes start appearing properly in sonography, the child's ankle joints, wrist joints etc. also develop, the intestines of the child gradually come inside the stomach, at first they keep bulging out of the stomach slightly. But by the 13th week it enters the stomach properly, now your baby starts swallowing the amniotic fluid which is the water around it and starts producing urine from it. Till now the water around the baby used to come from some other source. Till now it used to come from the placenta and the mother's side, but now the baby starts producing amniotic fluid on its own, through its urine. The amniotic fluid which is present in the body, swallows the water which is present around the baby and produces urine, which maintains its quantity, so it becomes a channel. The baby drinks it and when he excretes it in urine, it is maintained, amniotic fluid if there is some problem in the kidneys of the baby or there is some other problem due to which urine is not being produced properly. Then the quantity of amniotic fluid it starts decreasing and similarly if there is some problem in the throat of the child, or there is any problem due to which he is not able to swallow amniotic fluid or if the amniotic fluid is being produced in large quantity due to some other reason then the quantity of amniotic fluid starts increasing a lot. Later, this gives us an idea whether there is any problem with the child or not. The backbone of the child becomes very flexible, so we can easily see the movements of the child on sonography. Flexible movements or wide range of movements of the child are now possible. So let's talk about the changes that happen in the mother in the 13th week of pregnancy. As I told you in my previous videos, in the first 2 months of pregnancy, the mother's energy levels are very low, there is fatigue, feels like sleeping all the time, vomiting, nausea or headache, changes in the breast. All these things start reducing after the 13th week of pregnancy, so it becomes a very relaxing time, overall. The mother's energy levels become a little better. In comparison to the first 2 months, now the weight gain also starts becoming visible little by little, your uterus grows and because of that it starts to be felt on your stomach as well. Earlier in the first 2 months it is confined only to the pelvis, i.e., your bony structure, but by the 3rd month, because of the growth of the baby, we can feel it through your stomach as well, and you also feel a mass like a hard ball. As I said, the size of the uterus grows, you start feeling it in your stomach as well. So, that is why later on you may feel a little stretch and heaviness, because your ligaments are being stretched. They are being stretched and stressed, so as soon as you make movements, suddenly you stand up from a chair or get up from the bed, you may feel a little pain or stretch in the lower part, for some time. As soon as you have entered the 3rd month of pregnancy, your chances of abortion and miscarriage are reduced. If the blood flow in your body is good, then you may feel bleeding from soft tissues like your gums while brushing. Sometimes there is no problem in that. You can change your toothbrush to counteract that thing, you can use a soft toothbrush. So here are my tips for the 13th week, they are that first of all, if you have not had a checkup, then go to your doctor and get a normal routine checkup done, and 13th week is the time for your anti-NB sonography and double marker test. You should not skip these tests which are done at 13 weeks, these are important for the child, only these 2 tests are done at 13 weeks, all other blood tests are done before this. So if you have not done your blood tests at this time, then you have to get all those tests done now, otherwise, only anti-NB sonography and double marker test are enough at 13th week. If you have not got a tetanus injection at 13th week, then you have to get it done, and your doctor, looking at your symptoms, stops your progesterone tablets and pregnancy supporting tablets if they are not needed, and from now onwards, he starts advising you to take iron and calcium tablets along with a protein powder supplement or some vitamins. If you need them they add on that too. So this is about 13 weeks. After 13 weeks comes your 14th week, I will tell you what changes happen in your baby in the 14th week of pregnancy. So in the 14th week of pregnancy, your baby's ears used to be down earlier, now they shift upwards in their place, the baby's chin becomes prominent and his facial features become quite clear. By this time the baby's neck starts getting longer, the baby's fingerprints start developing, and the baby starts responding to stimuli, because his ears have developed, so if there is a loud sound then he reacts to it. If we rub our fingers and hands on the stomach then we can see the baby's reaction. In the 13th week, the baby swallows the amniotic fluid and produces urine. This process continues in the 14th week as well, and this amniotic fluid helps a lot in the baby's movements. So we can see that the baby is able to move very properly and easily. If the amniotic fluid is good, then blood production starts in the spleen of your child in the 14th week, so the red blood cells start getting produced. If we talk about the size of the baby inside the spleen, then if we measure the CRL crown rump length from the head to the lower part of the body, then it is almost as long as a chili, that is. The length of the baby is around 3.5 inches, so now let's talk about the changes that happen in the mother in the 14th week. So as I told you, in the 13th week, you may feel stretching in the lower part, your muscles and your skin start stretching a bit. You may have constipation due to pregnancy hormones, due to which they relax the bowel and intestines, so there may be a problem of constipation as well. Those who already had the problem of constipation, this problem can increase in them before pregnancy. Many times patients also have the problem of excessive salivation or excessive salivation. If you have any such problem like constipation, then you can discuss all these problems with your doctor, because this does not happen to everyone, so medicines are not given accordingly. If you have any problem in any particular trimester, any week, then you must share it with your doctor during his visit. Due to good blood flow at this time, you may start seeing spider veins or small blood vessels in the lower part of your leg. Some people also have a lot of blood flow on their face, or very fair people with thin skin also see blood vessels on the face, what we call spider veins. But all this, the changes are reversible after delivery, and they get cured automatically. So my tip for the 14th week is that, as I said, if you have constipation, excessive salivation, taste change, then you can try some home remedies for all these. Like you can drink more water. If you drink more water, it will help you in constipation problem. Along with this, include high fiber diet in your diet. You can take salads, you can take sprouts, you can take dal. Once a day at dinner time, you can include lightweight dalia porridge, which is rich in fiber but is a light diet, seasonal fruits and vegetables. I always advise you to include these in your diet. You should take a balanced diet in which everything should be present in the right quantity. There should be fruits, vegetables and pulses, and milk or milk products like curd or paneer should also be taken. This makes a complete balanced diet. You can take this once a day. It is not necessary that you have to eat so much every time, but over 24 hours your diet pattern should be such that all these things go into your stomach and provide nutrition to you and your child. The next tip is that, as I said, your muscles and skin start stretching, so you may feel a stretching pain down below. So the tip in that is that you should not stand up suddenly, you should stand up slowly with support. If you are changing your position anywhere, if you are sitting and you have to stand up, then stand up with support. Similarly, if you are lying down and you have to turn to your side, do it slowly, and if you have to stand up, then also sit on the bed first and then stand up. If you do anything suddenly with a jerk, you will feel pain in the lower part. The second thing is that if you feel pain, it is normal and it lasts for hardly 20 to 25 seconds, then it gets cured on its own. But even then, if you are feeling pain for a long time, then you should take rest, try lying down. If that pain does not go away by lying down, then it is normal pregnancy pain, and if that pain keeps increasing, then it may be if the stretch marks are increasing or causing some problem, the intensity is increasing and it is not reducing with time, then you should consult your doctor. The next tip is that to prevent your stretch marks, you can apply olive oil or coconut oil mixed with moisturizer in circular motion on the lower abdomen 3 to 4 times a day. Now let's talk about the changes that occur in your baby in the 15th week. So by the 15th week, the length of the baby becomes around 6.2 inches. Fine hair growth pattern is visible in the baby, very light. The light baby hair, which we call, grows on the body of the child. Along with this, the eyebrows and hair on the head of the child also start growing. By the 15th week, the development of the neck of the child is going on, so his strength, and as it grows, it becomes harder, as the 15th to 16th week approaches. The child can also be seen sucking his thumb many times. By the time the sonography shows 15 weeks, the child's internal body organs are almost fully developed, now they just start growing in size, so by the 15th week or 16th week, the maximum organogenesis of the child, that is, whatever development was to happen in the organs, happens, so that is why it is very important for you by this time, that you do not consume any such medicine, without the doctor's advice, due to which the growth of the child's organs gets affected. We also call them teratogenesis drugs or X-category drugs, which can affect the organogenesis of your child, so all these drugs should be taken in the 15th and 16th weeks till now. They are not given at all, so let's talk about what changes you can feel as a mother in the 15th week of pregnancy. So as I explained, the baby is growing, along with it, the uterus is also growing, so we now start feeling it in the lower part of the stomach. So now in the 15th week, it is seen moving up gradually, we start feeling the uterus even higher. Understand it like this. 3 to 4 inches below your navel or 3 to 4 fingers below, we can now feel the uterus very easily. In the 15th week of pregnancy, if you have not yet got your double marker test done, which you should have got done by the 13th week, then the doctor now advises you to get the quadruple marker test done. In the quadruple marker test, for hormones of pregnancy are studied. According to that, an estimate is made whether the child has any chromosomal or genetic problem or not. Quadruple marker is not done for everyone. If you have not done double marker or there is a problem in your double marker, or some problem is seen in sonography, only then quadruple marker test is done. Due to nausea and vomiting or you were not feeling hungry, your weight had decreased, now it starts increasing little by little. So you can see weight gain of about half a kilo to 1 kilo every week, but this is not necessary. It also depends on your food and drink, it also depends on your body metabolism that how much weight will be gained, but on an average you see weight gain. So my tip for the 15th week of pregnancy is that whatever tips I have told you till now, you have to continue them. Along with this, you have to lie on your left lateral side, i.e. on the opposite side. This will keep your baby's blood flow good, circulation remains good. As I explained to you that the size of the uterus is increasing, the baby is growing inside, so now you can feel the uterus at the level of your stomach, that is 3 to 4 fingers below the navel. I said, you can feel it down. If you lie straight in this position, i.e. on your back, then the uterus falls back, that means due to its pressure or weight, it falls backwards, and behind, the main vessels of your body which are carrying blood supply from the heart to your lower part. So what happens is that due to the pressure of your uterus or weight, its blood flow decreases, or there is resistance in it due to which ultimately the blood flow to the uterus also reduces. If the blood flow to the uterus reduces, then the blood flow to the baby will also reduce ultimately and it can affect his growth. That is why the advice is that you should lie down either on the right lateral or left lateral side, that is, on your side, and out of the two, the left position is better because the inclination of the uterus is slightly more towards the right, so if you are lying on the left, the baby will get maximum blood flow and oxygen. At this time, it is possible that you may have problems sleeping or have problems in taking positions. If your sleep keeps getting interrupted, then you can use your pregnancy pillow here, or simply, you can use your normal pillows to support your back. One pillow. Keep a pillow in front of your stomach for support and keep a pillow between your legs, between your knees. This will help you a lot. You will get proper sleep and your sleep will not be interrupted again and again, and the pain that happens due to the position will also not happen. So from here you can start using your pregnancy pillows or normal pillows. So friends, in this video I told you about the 13th week, 14th week and 15th week of pregnancy so far. So now let's talk about the last week of the 4th month. What changes happen in the 16th week of pregnancy? So first of all let's talk about the baby. So as I said, the organogenesis of the baby is complete. His internal organs are fully developed. They just keep growing in size. Now you can see that your baby is moving properly inside. The baby's hair grows longer. The hair on the baby's head grows more. The baby's systems become functional. The nervous system becomes functional. The cardiovascular system becomes functional. Your baby's eye movement starts. The eyes are closed right now. The baby's eyelids are closed right now. But still the eye movements start inside. The baby is able to move his fingers, hands and legs easily. The strength of the baby's bones is increasing every week. That's why You should pay attention to calcium. You must take a daily dose of calcium every time. The bones of the child appear bright white on sonography, because they get ossified and calcified. Now the length of your baby becomes almost around 7 inches, so let's talk about the changes that happen in mothers. Mothers may feel a little discomfort in the 16th week of pregnancy due to the baby being on top of the uterus, but they get a lot of relaxation in urinary frequency. The problem of frequent urination gets settled by this time. Due to good blood flow in your body, you may notice slight swelling or dilated veins in your legs. You may have problems of gum bleeds and nose bleeds. You may have a runny nose, so talk to your doctor about it beforehand. What precautions do you need to take in the 16th week of pregnancy? If you are having your first child or you are getting pregnant for the second or third time, then you may sometimes feel the baby's movements, which we call quickening. Whenever a mother feels the baby's movements for the first time, we call it quickening. So if you are getting pregnant for the first time and it is your first pregnancy, then you will not feel these quickening movements at all, so do not worry and panic. In the first pregnancy, sometimes it takes up to 24 weeks to feel the baby's movements for the first time, but on an average. If it is your first pregnancy, then you may feel these quickening movements in 18 to 20 weeks, and if it is your second or third pregnancy, then you may feel them even sooner because you already have experience of how these movements happen, so you can analyze it quickly. But if this is your first pregnancy, then because these movements are very light, you get confused whether these are gas movements or intestinal movements, or some other light movement like this. So my tip for the 16th week of pregnancy is that if you have not yet got a sonography done, or you have missed the 3rd month sonography done, or you have missed the 3rd month sonography, then you should get a sonography done here to see whether everything is going well inside or not. Secondly, if you want to avoid stretch marks, then you have to start massaging with your moisturizers and olive oil or normal coconut oil if you have not done it yet. Thirdly, if you have pain in the lower part, or you feel a stretch while walking, then you have to take rest in between and work. If you are working, you can take a 10-minute break after every hour of work and walk a little. You can change positions. You don't have to spend too much time in one position. As I said, in your 16th week, your blood flow increases, so some people may feel swelling in their legs. So for that, you have to take rest in between and keep your legs elevated. You have to put a stool so that the height of your legs comes to the level of the body, so that the blood flow starts easily. You can sleep again every night by keeping a pillow under your legs so that the swelling of the whole day gets cured on the same day. If you don't do this, then day by day that swelling keeps increasing and later becomes very severe, which is not cured by doing anything. That is why it is better that whenever you see swelling, you should go to the doctor. If it happens for the first time, you should start doing this from that time itself. Keep a pillow under your feet while sleeping at night, and if the swelling is more, you can also massage it, but keep in mind that the direction of massage in the body should be from bottom to top. That is, you have to massage your feet by pulling them upwards from your soles or ankle joints, so that whatever swelling has developed in the lower part, the blood flow starts upwards and the swelling reduces. If you are a working woman or you have to stand for a very long time, then you can also use stockings. Leg compression stockings are available. You can easily find them at any medical shop or pharmacy. You have to wear them on your feet like socks, so that a little tightness pressure remains and you will not develop swelling. So friends, this was my video on 13th, 14th, 15th and 16th week of pregnancy. I hope that I have provided you some knowledge through this video.